Hello everyone. Thank you for joining me today. My name is Arasu Narayan, and I am currently serving as a senior principal data scientist at Oracle. I have had a privilege of being in the industry for the past 2 decades, with the last 8 years especially focused on natural language processing or NLP. During my academic journey, uh, I completed my PhD dissertation in the field of NLP, which I laid the foundation for the work I am passionate about today. For the past several years, I have been deeply engaged in the supply chain, healthcare, and other sectors, exploring how we can leverage NLP to solve real world challenges. The intersection of healthcare and technology presents a unique opportunity to improve patients' outcomes, streamline process, and reduce administrative burdens. In this presentation, I will be sharing some of the findings from my recent work on text summarization using medical transcripts. Especially, I will evaluate different language models to understand their strengths, limitations in this critical application. I am excited to share these insights with you and looking forward our discussion in the NLP summit. Yeah, let us dive in the heart of our discussion today, how text summarization, particularly of medical transcript, can transform patient care management workflows. The primary goal here is to enhance efficiency and effectiveness of the patient's care. By leveraging advanced NLP techniques for patient summarization, we aim to significantly reduce the administrative burdens on the care coordinators. For instance, our work demonstrates the potential to cut down the time spent by care coordinates to preparing for patients checked in by over 50%. This is a substantial improvement, freeing valuable limit or valuable time that can redirected towards patient engagement and personalized care. Moreover, with these efficiency gains, care coordinates can manage larger caseloads without compromising their quality of care. This is not only the benefits healthcare providers by optimizing the resource allocation, but also improves patients' outcome by ensuring more consistent and timely care. As we evaluate different language model in this context, our focus is on understanding which model offer the most accurate, efficient summaries that meets these critical needs in this healthcare sector. I am eager to share more about the methodologies we employed and insights we gained through this research. And let us talk about the data set that I was using in this research. It's a medical data, as we know, is challenging to access due to stringent HIPAA privacy regularization, which is a critical aspect of protecting patients' confidentiality. To navigate this constraint, we utilized a data set composed of sample medical transcript spanning various medical specialties. This approach allows us to conduct meaningful research and development without compromising patients' privacy. This dataset is quite comprehensive, consists of several key columns, such as description, which is a brief overview that encapsulate the essence of each transcript. Medical specialty, the classification label is indicating the special medical field to which transcripts belongs. Sample name is a title or identifier for each transcripts entry. Then it's a transcription. is a core content, which is the actual medical transcription text. Then keywords, the key terms extracted from the transcript, providing insights into the relevant medical context. It is too important to note that this data set was sourced by scraping context from mtsamples.com, a publicly available repository of medical transcript samples. The data set is not only facilitates text summarization research, but also present intriguing challenge. Can we accurately classify medical specialties based on the content of transcript text? This combination of the structured data set and the challenges it is possesses makes it valuable resource for advancing NLP application in healthcare. Moving on the text summarization methods employed in this research, we have explored several advanced models, each of its own unique strengths. First, we have Claude. Claude is based on transformers architecture, similar to GPT, but with the optimization aims at enhancing interpretability and control in AI outputs. Its key features include strong focuses on the safe and aligned AI behavior, emphasizing transparency in decision making. Claude is particularly suitable for application that require human-like reasoning and adaptability. Next is the OpenAI. Here I was using OpenAI GPT 4.0 being the latest iteration. These models also are transformer based and they excel the natural language understanding and generation. The GPT models are autoregressive, predicting the next word in a sequence of sequence to generate a coherent text. The versatility of these GPT models across various NLP tasks is unmatched thanks to the extensive training on diverse data set, which leads to the strong generalization. Then there is a Llama 3.1. Llama stands for Language Learning and Modeling Architecture. This model uses enhanced version of the transformer model, optimized for low resources languages and the efficient training. It focuses on multilingual capabilities and particularly efficient in handling specialized and domain-specific tasks, making it a powerful tool in low-resource scenarios. Lastly, we have Pi or P 3.1. This model is built on proprietary architecture that enhances transformers models for faster processing and reduced latency. This P 3.1 emphasizes efficiency and scalability, especially in the large scale text summarization task. It is optimized for the real-time applications, delivering strong performance in tasks that require quick comprehension and summary generation. Each of these models brings something valuable to this table, and understanding this specific strength allows us to choose the right tool for this task at hand. So for evaluating the quality of text summaries is a crucial step in understanding efficiency of our summarization models to objectively access how well these models perform. We rely on set of established evaluation matrices. The primary matrices I used are row 1, row 2, row L, the scores. Row 1 measures the overlap of unigrams, single words between the generated summary and the reference summary. This matrices help us to understand how much core content is captured in this summary. Row 2 goes a step further by evaluating the overlap of bigram or two consecutive words. This matrices assesses how well the summary preserves the flow of information. Then ROCL, which is focused on the long common consequences between generated and the reference summaries, captured this overall similarity in sequence and structure. These matrices are widely used because they they quantify n-gram overlaps, which is essential for ensuring that generated summary retains critical information from the original text. In addition to ROG score, we also employ cosine similarity as an evaluation matrix. Cosine similarity measures the cosines of the angle between two vectors. In this case, the vectors forms the generated versus the reference summaries. It captures the semantic similarity between the text, providing insights into how closely the meaningful of the summaries align beyond just surface level band matching. For our evaluation, we considered summaries generated by Claude model as a ground truth. That means performance of other models will be compared against these referenced summaries to determine their effectiveness. By combining these matrices, we can comprehensively evaluate the quality of the summaries produced by different models and ensure that they meet the desired standards of accuracy and relevance. So I was using various prompts to extract the text from the unstructured the transcripts. So and here is the examples. This model outputs are analyzed by comparing the generated summaries against the ground truth, focused on both quantitative matrices like ROG scores and qualitative assessments. This analysis highlighted the strengths and limitation of each of these model in accurately capturing the essential information from the medical transcripts. So here is the output of OpenAI. In the OpenAI, here you can see the patient information, medical specialty, current symptoms, fast medical history, family medical history, social history, allergies, current medication, that's including the medication name, dosage, the frequency, then any surgical histories are there, and the physical examination, the various diagnosis reports, that's including blood work, radiology, pathology, urine analysis, other tests. So here, I think this particular records belongs to urology specialty. Then the assessment, the treatment plan, the follow-up instruction, then consultation summary. If some of the informations are not applicable for this patient or this transcript, so I think here is specified as a not performed or not taken. Those are the information is extracted, I think, from the model. Then there is the next one is the Claude model. So the Claude model, I think, performed very well. That's the reason I considered this Claude model as a ground truth model. So here you can see along with this patient summary, patient information, medical specialty, current symptoms, past medical history, and everything. It also got this immunization records, the viral signature, that it has various these parameters, then this diagnosis report, physical examination. So it provided a little bit of descriptive information. And if you look at the progress status, discharge with the good urinary streams and minimal hematuria is provided some additional information than this OpenAI. That's the reason I considered this is my base model for comparing this other one. Here is this llama. This llama, there are some room for improvements on this llama. I think I'm supposed to tune this model a little bit to get some good accuracy. Some cases, I think it did a pretty great job. Yeah, then Yeah, here everything's provided some kind of small symbol, some hallucination as well. I think the doctor informations are not there, but it says that follow up with the doctor ABC like that. Then this is the by 3.1. I validated a few other models. Here I'm just listing down only these three models. So let us go to some comparisons with this evaluation. So I had a few evaluation matrices, so like a qualitative and quantitative. But here I am just showing only some quantitative matrices. So let us now turn on our attention to the quantitative evaluation of these models we discussed earlier. These matrices give us a clear picture of how each model performs in terms of generating accuracy and relevant summaries. Starting with the OpenAI GPT, the results are impressive. The ROC is 0.821, ROC 2 is 0.7, ROC L is 0.76, cosine similarity is close to 0.879. Yeah, I think overall, I extracted I think around 500 plus medical transcripts among the close to 5,000 transcripts. So the data set has around 5,000 transcript. I was playing around 5,000 different specialty, 5,000 transcript from the different specialty. Then here the next one is the Llama. Llama 3.1. Here is this Llama, the 3.1 matrices. This is a little bit lower than the OpenAI. While Llama 3.1 perform decently, especially in handling specialized tasks, its scores suggest that slightly less effective in maintaining content overlap and semantic alignment compared to the GPT. Lastly, look at the P 3.1. This is much better than the Llama model. Where if you look at this, all these matrices, the matrices are really pretty good. The Llama 3.1 demonstrate a strong performance with its matrices falling just behind GPT-4, but still ahead of Llama 3.1. The cosine similarity score 0.819 shows that the P 3.1 is quite effective at generating summaries that aligns with the meaningful of the source text. In summary, while all these models have their strengths, OpenAI GPT series consistently leads across the board, followed by the P 3.1 and Llama 3.1, providing more specialized but slightly less comprehensive performance. This matrices indicates that OpenAI GPT series model outperform these others, particularly ROC, cosine similarity, and the other matrices. Yeah, the key observation. Let us now delve into the key observation from our analysis of the results. Best performing model. So, as we discussed, the OpenAI GPT series emerged as a best performing model, consistently ranking highest across the matrices, including ROC 1, ROC 2, and cosine similarity. This performance indicates that the GPT 3.1 the GPT-4 is particularly effective at capturing both the breadth of the information and semantically content to the original text, making to its robust choice for the comprehensive summarization task. The trade-off. However, there are some trade-off to consider. While OpenAI model excels in accuracy, it may sometimes generate the longer summaries, which might be less concise compared to the other models. In the other hand, The Pi 3.1, though slightly lower in accuracies, offers better balance between accuracy and conciseness. This makes Pi 3.1 more suitable for scenarios where length of the summary is critical factors and conciseness is preferred. The other thing, the P 3.1 is a very lightweight model. We can deploy this model in the devices like a iPad or the other devices where the doctors or the nurses are carrying. So I think we recommend that might be one of the potential candidate. Then the model specialization. It also important to consider this model specialization. The Llama 3.1, for example, is performed less effectively overall, particularly when dealing with the complex or detailed medical notes. This suggests the trade-off between this model efficiency and the depth of the summary generated. On the flip side, P3.1 might be the better suited for more structured medical notes such as procedural summaries, diagnosis reports, where brevity and relevance are the key. In contrast, OpenAI GPT series appears to be better suited for narrative driven nodes that requires comprehensive coverage. In summary, OpenAI GPT series is the top performance. The choice of this model may depend on specific use cases, particularly when balancing accuracy and summary length, dealing with structured versus narrative content. Then challenges. What are the various challenges we faced during my this experiment? Summarizing the medical text is fraught with the unique challenges that need to be carefully navigated to ensure accuracy and safety of the generated summaries. Complexity of the medical language. Medical language is inherently complex. It's filled with the jargons, specialty terminology, and abbreviations that can vary widely across the different specialties or regions. This complexity possesses a significant challenge for summarization models, which must accurately parse and content the text while preserving their meanings. Then importance of this retaining the critical information. Another critical challenge is ensuring that all the essential information is retained in the summary. Medical text is often include crucial details such as patient diagnosis, treatment plans, medical histories. Summarizing these texts require delicate balance between being concise and maintaining completeness. Any omission of these key details could lead into harmful consequences in the clinical settings, making this high stakes task. Model limitation. There is also inherent limitation in the model themselves, like a hallucination. One of the risks is some models may generate information that was not present in the original context. This phenomenon is called as the hallucination, can lead into potential misinformation, a particular dangerous risk in the medical domain, where accuracy is paramount. Then lack of context understanding. Additionally, the model can struggle with understanding this broader context of these medical notes. This can result summaries that miss the crucial nuisance or misinterpret the significance of critical medical terms and findings. The future works as we look ahead. There are several promising avenues for future works in this area of medical text. Model improvements. One key direction is to fine-tuning this model, especially on the medical data, by leveraging large and more diverse medical data sets can help the model better and understand this inheritance and nuisance of this medical language, integrating this domain-specific knowledge. Another area of enhancement is to integration of this domain-specific knowledge, such as medical ontology, incorporating these structured knowledge bases could significantly enhance the model understanding of complex medical concepts and this relationship. Then human in the loop of approaches, finally adopting human in the loop methodologies could be a game changer by involving clinicians directly in the summarization process can create collaborative approach where human expertise guides the validates and this model output. Okay, in the conclusion, the accurate summarization of medical notes is a vital of enhancing efficiency of the healthcare professionals. It reduces the burden of documentation and ensures that critical patient information is communicated effectively, which is essential for maintaining high standards of patient care. Our evaluation identified OpenGPT is a series of more effective models, excelling both precision, semantic, and understanding. When you compare with this one with the Claude, the Claude will be the first one. That's why we manually evaluated Claude's output and considered as a ground truth model. I can consider the first model should be the Claude model. Then the P3.1 also demonstrated strong performance, particularly in balancing accuracy with a conciseness, making a viable option for some summary length is a critical factor. So we look into the future, the continued development of and development and refinement of these technologies could position AI as a central player in the healthcare, not just for documentation, but in the broader clinical decision-making process. Ultimately, this leads to improved patients' outcome and a more efficient healthcare system overall. Thank you for watching, and thank you for your attention.